A simple blood test could tell a woman if there is still time for her to have a baby. The test used to be used for women who were already struggling with fertility. Well, now it is being used to predict infertility problems before a couple tries to conceive. And joining us this morning is a fertility expert, Dr. Mark Trolice. Always great to see you. Thank you so much for being here.
My pleasure, Amy.
So tell me about this test. How does this work?
The test is called Anti-Mullerian Hormone.
Okay.
It's been around for the last probably 5 or more years, but much more clinically used now than ever before. The problem is that why do we use this test?
Okay.
And there's a lot of misconceptions about this test. It's a hormone produced around the cells of the egg, and it reflects how many eggs you have. The lower the hormone level, the lower the number of eggs. But the key question is when to use the test and why. Women are thinking, and some clinics are even supporting the fact that they could use this to screen for your fertility potential, and that's just not true. What it tells us is how many eggs you have left, and how do I use it? I use it in a way to determine how to stimulate a woman who's going to be going on injectable fertility medication, and how many eggs we're going to be getting if we do that test. That's a good indication to do that.
But it's not going to tell you the health of the egg, because it's really the viability of the egg that matters, not how many you have, right?
Exactly, exactly. This is not a test in any way to tell you your chances for an average woman, what your chances to have a baby.
Okay.
What we do know, though, is that when you're above age 35 and the hormone level is extremely low, your chance of success with IVF goes down.
Okay.
But we don't know in a general population, if we just get this test, what's the patient's chances of having a live birth, okay? Now, we use it also to screen egg donors. I work with an egg donor bank, actually, Cryos International near UCF, and we use it to screen candidates who want to donate their eggs, because if they have a good anti-Mullerian hormone level, we're going to get a good number of eggs. But the important thing is this, Amy. This hormone test is not a screen for a woman's ability to have a baby.
Okay.
The potential to have a baby is not there yet using this test.
And your fear is that there might be some misinformation out there, or people who are confusing it as a barometer for that.
Oh, absolutely. It's not a screen in any way to say that, okay, this level is good, you're going to have a baby. I think if the level is low and you're trying to have a child, you probably want to get a little bit more aggressive sooner than later.
Okay. Dr. Trolice, how can our viewers find you?
Website is theivfcenter.com.
All right. This man performs miracles every day. Dr. Trolice, always great to see you. Thank you so much for being with us this morning.
My pleasure, Amy. Thank you.
8:16.